Welcome back to part 2 of our interview with Dr. Karen Lawford. Today we're going to be looking more into her research regarding birth evacuation within the Indigenous reserve communities.
So there is this really nonsense, super racist, uninformed idea in the world that Indigenous people living in rural and remote communities love traveling for healthcare because they can go shopping. And I can't believe how ignorant that is. And I thought, okay, that stupid idea has gone away. But in fact, I just heard this the other week. No, we don't like traveling for shopping and leaving our entire family going into a healthcare system that's racist, that we might not come out alive of, that we're going to experience racist comments, derogatory comments, maltreatment, who knows what, forced will be sterilized. That's what people are scared of. They don't care about their shopping. I can't believe how ignorant and racist that idea is. Empty it from your mind. People don't want to leave their community. And like this, of course, people are going to go shopping when they're traveling. What else is there to do? You took away and this idea of evacuation. So between 36 and 38 weeks for normal, healthy pregnancies, people, regardless of their health status, have to leave their community for maternity care services. I've been told that if they don't leave, these are some of the stories, the police will come and get them. So actually, this one OB, I don't know if he's an OB or family doc. He's probably a family doc that did obstetrics in the north. He told me, and he was so proud and gleeful that he called the police on a woman and they had her handcuffed and they put her on the plane. So she was evacuated south. Honestly, what? That HE double hockey sticks, that's a story someone thinks they can recount to me. And I was just like, you are so messed up. And you use your power and authority to literally engage the prison industrial complex for the sake of having a baby. This is why people hide. This is why people don't access care. People don't believe the racism that happens in this country unless it's recorded. Like, what? We don't believe people when they say, like, we are deeply flawed in this country if we think that we need this double blind. That's totally ableist language, right? And disgusting. Mm-hmm. The levels of research, and someone's telling you the healthcare system is not working, not just someone, a whole bunch of people. Think about we don't even know how many people are worthy their death of an investigation and an inquest, because people are exhausted and they have no other recourse other than doing this because of the way in which the healthcare industrial complex has now leveraged its services onto Indigenous people via the prison industrial complex. This is disgusting. This seems like an egregious violation of human rights and choice and dignity. Sure, there might be a healthy mom in terms of a Western perspective and a healthy baby at the end, but what did that service destroy in the meantime? We know that historically that there was the tuberculosis hospitals and the Indian hospitals were a site of civilization and assimilation, and that there were horrible things done at those hospitals. We know about nutrition experiments. We know about genetic experiments. Why don't people understand that Indigenous peoples have a rightful reason, a legitimate reason for not trusting the healthcare services and forcing people to be evacuated for birth? While midwives actually want to work on reserves, let's have a facilitated conversation so that we can make this happen. We have known about this for at least 20 years. People have been evacuated as a routine across this entire country since at least the early 70s. Since the late 1800s, the government of Canada purposely interfered with maternity care practices of First Nations. Don't even include the Indian residential schools, how they were monitoring the birth so they knew which child and when to apprehend via the RCMP, via the Indian agent to take them to these residential school systems. How many more children are we going to find? This is all related. So midwifery is an intervention, and I really do want to stress, particularly Indigenous midwifery is an intervention to change the direction of colonial genocide. That, I think, it's not just about the evacuation policy. It's one piece of a larger picture of, if you can't kill all the Indians, if you can't assimilate, if you can't commit genocide via the physical killing of Indigenous peoples, we're going to actually take them off their lands. We're going to civilize them and assimilate them into generic body politic, which has always been the goal of this country. Indigenous peoples are saying no, and we value ourselves, we value our ancestors, our youth, our teachings, our customs, which are dynamic and take into consideration the modernity that we live in. I'm talking to you through Zoom. Guess what? I'm one of those Indians, because guess what? We're dynamic people and we respond to the environment around us. So again, this seems like a little tiny piece, and it is, but it's within a broader context of the colonial machinery that is advancing genocide. And I do want to note that, there's a reason this information is not being shared. Just like the Indian residential schools, they didn't want you to know about that as, the person living in, I don't know where you live, I'm going to make it up and pretend you're in Vancouver. But it's because then you'll start to ask questions, and then you'll start to want to know the answers, and then you'll start to learn because you want to disrupt the system. And that's what I see young people doing. It's not that my faith lies in the young people, but I need you to know the history, what's going on now, because this is something that is affecting your life. You're part of this, you're complicit too, and with the government of Canada. And I want you to know that this is part of the story so that you can learn from it, and also then consider the context in which Indigenous peoples live. When you're the ER physician and someone comes in and they're sleeping, allegedly, are they drunk? Are they having an overdose? Are they having sepsis? Are they having a stroke? Do your job. And your job, though, I hope, is made lighter by knowing that this is something that is not individual, but systemic, so that you can actually make those individual changes, because you do matter and you can make a difference. And that's what I hear a lot of young people saying, is like, the students is like, this has to change, and it does. So I just want to encourage and give courage to people who want to make a change where it fits with what their passion is. So this is obviously my passion, because I really believe in families and communities, and I do believe in informed choice. I believe in information sharing, and I do believe in having a reciprocal, responsible, ethical relationship with patients, and with my caregivers as a patient. That's a really good question, and I think it depends on where you live. There are physicians in this world, and I really hope that I haven't conveyed all physicians and OBs and nurses within the same. There are people who are great and working within that system, and that's why people talk to each other. That's why they have these Facebook groups, closed, private, like, oh, I want to have a vaginal birth after my first cesarean section. Which OBs are supportive of that? Can I still have a midwife? And I think that there's a lot of critique, obviously, rightly so, especially with what happened with Facebook, Instagram, and whatever that other one is, yesterday, in terms of huge concerns with influencing and harming people through social media, knowingly, for the sake of monetary gain. But these are also places where people can connect across various physical locations to find out information. Who can I trust? People want to work with trustworthy care providers. Let's grow a group, but also then let's have a healthcare system that is worthy of trust. It's not just about the individuals. And clearly the system as we've designed it is not working. I think we're really in a complicated time right now because of the COVID and anti-vaccinations, and of course knowing that there are people who can't get vaccinated for reasons that's between them and their healthcare provider, but that's really influencing how we're able to respond. And I wonder what will we learn from this, that our over reliance on healthcare as a point of care instead of public healthcare and education, so that people can trust the healthcare system that says we need to vaccinate. There is a reason why people are afraid of vaccinations, because of experiments, because of the actual lies, because of the over influence of pharmaceuticals industry on the prescribing of certain medications, because of the all-inclusive paid chips that people get when they prescribe certain medications. Like, there is a reason. We have to start listening to people instead of those with power. We have to take that back. Anarchy, no, and I don't know. And I think that's what we're seeing perhaps with the anti-vaccination groups. They're resisting, but how do we then immediately make that change of information? I don't think we can, because we've let it far too fall behind. Of course, it doesn't help when you have publicly elected officials like the Premier Ford, who has defunded public health. So we have even taken away the ways in which we can build trust in the healthcare systems, by extension, eroding the trust with our healthcare, with our leaders and our political leaders. It's a bit of a mess, I think.
Once again, we would like to thank Dr. Karen Lawford for sitting down with us to discuss the issue of birth evacuation. Tune in next week for the final part of our interview, where we discuss what the Canadian healthcare system and current healthcare professionals must do to better accommodate for the needs of Indigenous women.